All right, so this is the third part of lecture video for chapter 14. I did get reached out to by one of you wonderful afternoon students to let me know that the lecture video for today actually cut off for a while and then came back up. So the only thing I can think that happened is maybe my Wi-Fi or internet shut down for a little bit and caused the lag on that. So as long as you were reviewing the PowerPoint, that is what I'm covering, the material I'm covering. So anything in that period of time, as long as you've been reviewing the PowerPoint from beginning and now through the end, you'll be just fine. So we're picking up on slide 31 for contraception. So during practice, or contraception is any practice that serves to prevent pregnancy. So there are different types or methods of contraception. So non-pharmacologic would be using abstinence or natural birth control. Pharmacologic would be your oral contraceptives, so the pill, barrier methods, transdermal and vaginal contraceptives, different types of injections, implants, and intrauterine devices, so things like the Mirena, that type of thing that are actually inserted into the uterus. So the male condom is the first form and probably the most widely used barrier protection. Comes in different from different manufacturers. There can be an issue if an individual is allergic to latex. There is a female condom, and then there's also the diaphragm or cervical cap. Commonly prescribed oral contraception or contraceptives. This is probably one of the most common routes that individuals take to prevent pregnancy. There's, they work by manipulating the hormones to prevent ovulation, and then they actually change the texture of the cervical mucus, which prevents the sperm from being able to reach an egg. So there is a lot of controversy that circles around oral contraceptives and whether there's an increased risk of cancer in women with a history of breast, endometrial, ovarian or cervical cancer. That's one thing that we have to be very cautious of. It is shown that in particular some breast cancers are estrogen fueled. So if a female has been using birth control from 15, 16 years old and they're now into their 40s, that's a lot of years that they have been putting additional estrogens into their body, and that presents a higher risk. Advantages of using products that only contain progestins, as it's a lower hormone dose, which is always a positive thing, and it can reduce the side effects that are associated with the estrogen, so headaches, elevated blood pressure, and we can use this in patients that do have a history of breast cancer in their family. Smoking in conjunction with hormone therapy greatly increases the risk of heart attacks, blood clots, and strokes. A disadvantage of products that only contain progestin is that if there's any type of missed doses, it can quickly cause a failure rate in how effective the contraceptive is. So if you miss a dose or you miss a couple doses, you have a higher risk of actually becoming pregnant versus missing a couple doses of the estrogen and progestin combo, oral contraceptives. And then obviously oral contraceptives do not prevent or stop the spread of any sexual transmitted infections. Emergency contraceptives, so we're talking about things like Plan B. These are used for the prevention of pregnancy after unprotected sex and prior to implantation. So the important thing about Plan B, it's a very sensitive subject because of the role that it plays in what it does. So the pharmacy world has allowed, if you or the pharmacist or anyone there has a issue with dispensing Plan B, which is now available for purchase over the counter without a prescription, because of ethical beliefs, religious beliefs, whatever the reasoning is, you have the right to refuse to sell it. However, you must find someone else within the store that will sell it to that individual. So it does give the option for you to say, I don't, it's against my beliefs, I don't want to sell this, but you have to find someone else within the store that is going to sell it for you. Now, when you are selling the Plan B, the individual that you are selling it to, you need to make sure that they speak to the pharmacist before you complete the transaction, because the pharmacist needs to explain to them that this is something that should be taken in the first 48 to 72 hours of after unprotected sex. This is not something that is designed to be a month later and there's a suspected pregnancy, because it can abort the pregnancy, but in most cases, because they're so far along, it will not, but it will probably cause some birth defects. So it's important that the pharmacist talks to whoever the individual is purchasing it, so that they are aware that it should be in that 48-hour to 72-hour window. Other hormonal contraceptives, again, there's transdermals, so you have a patch. These are common. Vaginal contraceptives, so NuvaRing. Again, there's the injection, so medroxyprogesterone, that's Depo-Provera. That's given every 3 months. And then implant. So there's a lot of different options. A lot of women feel that they have, a harder time taking or remembering to take their birth control pills every day. I'm plugging in my computer here, sorry. And so they're looking for a more long-term option that they're not having to remember every single day. And that would be something like the injection or the implantation would come into effect. Even the NuvaRing, because that's placed over a period of time and not changed daily. So pregnancy tests, that's something that you need to be aware of. You're going to be selling a ton of those. Kind of really anywhere that you work outside of a hospital. We do have pregnancy tests inside of a hospital that we put into the Pyxis machines to test, patients in the ER. They will test patients before certain surgeries and stuff like that. So the benefits, obviously, of early detection of a pregnancy is the earlier prenatal care that the individual is receiving. It can also provide earlier detection of an ectopic pregnancy, whereas the fertilized egg has implanted in I can't think of it now, the fallopian tube, which brings your eggs from your ovaries down into the uterus. And so instead of the egg making its way into the uterus, it actually implanted in that tube. So that's dangerous. That has to be taken care of. Hormone pregnancy tests, so there's many out there. First Response, EPT, Clear Blue. They're a lot easier to read than they were even quite a few years ago. And how they detect a pregnancy is actually based on detecting HCG, which is a human chorionic gonadotropin, which is a hormone your body produces when you become pregnant. So that's what changes the color or makes the little cross or whatever the test is. So most of these have become very sophisticated tests. You used to not be able to test until 5 days after your missed period, but now you can even test right up to the first day of after your missed period. That's how sensitive these tests are now, and typically the results are available in 1 to 5 minutes. Nutrition of sexually active women. So whether you are planning on having children or not and you are sexually active, it's actually recommended that you are taking the daily requirements of folic acid, iron, and calcium. Folic acid especially, because folic acid is essential, especially in the first 4 to 8 weeks of fetal development, to help prevent against any neural tube defects for babies that are being developed. So neural tube defects would be things like spina bifida, where the baby is born with a hole in their the lining that protects their spine, the development of the spinal cord itself, the development of the brain stem. So all of the central nervous system workings of the baby develop in that first 4 to 8 weeks, and folic acid is essential for that development. Once someone becomes pregnant and they're ready for labor, there's quite a few drugs that they use. Some women will go into labor naturally, some will not. And so we have drugs that are used to induce labor. Most of them are used in a gel or cream type setting where the doctor will place those into the vagina to go ahead and start ripening the cervix, allowing the cervix to start opening up and allowing the body to go into labor. And then oxytocin. Oxytocin is something that our bodies produce naturally, but if your body's not producing it to go into labor, we have a synthetic version of it that we give, and it starts to stimulate contractions pretty quickly and can get labor moving pretty quick. Drugs used for premature labor. So let's say an individual is going into preterm labor. There are drugs that we can use to stop it as long as mom is not suffering from preeclampsia or eclampsia, which are two very life-threatening conditions to both baby and mom. It's a rapid and increased rise in blood pressure. It can be fatal. So there's things that they're going to look at to see if it's worth stopping the pregnancy or just going ahead and allowing, or I should say the labor, not the pregnancy, or allowing the labor to go ahead and continue and just dealing with the premature birth at that point. So osteoporosis. Your bones are constantly being replaced. So you have what are called osteoclasts, which reabsorb bone. And then we have osteoblasts, which actually form bone. So the difference between the two is your osteoclast will reabsorb bone, and osteoblast will actually form new bone. Opposing activities of both osteoclasts and osteoblasts are what is necessary to have a balanced, normal bone structure and diminishing and replenishing of your bones. So osteoporosis is a condition of reduced bone mineral density, which is basically a disruption of the bone structure and leads to an increased risk of fracture. Osteoporosis is typically a result of a deficiency in estrogen, calcium, and vitamin D. So those are the three essential things that we have to have for bone formation. And as I talked about in an earlier video that hopefully you were able to see, as women age, women are more at risk for osteoporosis because as we hit menopause, the amount of estrogen that our body is producing is drastically declined, and that's why women of that age start to have to test for osteoporosis because it increases our risk for that. Calcium, many of our diets are not the best, and we're not getting our daily supplementation of calcium, and we're also not getting our daily supplementation of vitamin D. So one of our main sources of vitamin D is actually from the sun, and we know living here in southern Arizona, in the summertime we typically don't go out until sundown unless it's absolutely necessary, going to and from work, but we're not spending any significant time outside to get the sun unless you're swimming or something like that, but even still you're putting on sunscreen. So your body is not absorbing the vitamin D from the sun or the UV rays as we need it. So in southern Arizona, and even cities across beaches, so East Coast, West Coast, you would be surprised that we actually have the highest rates of vitamin D deficiency, even though we have the most sunshine. But it's because we use so much sunscreen, and then here in Arizona we try to avoid the heat of the day as much as possible. When you have osteoporosis, It can affect pretty much any bone in any joint. So you can have fractures in the hips, you can get fractures in your spines, you can get fractures in your wrists. And, as people age and the thinning of the bones, and the more you're exposed to a loss of calcium and your loss of estrogen, when individuals fall, that's where those fractures typically take place. But sometimes the bone can just fracture just because of how weak and frail it is. So risk factors. Female, gender, Caucasian or Asian ethnicity, family history, a small body frame, smoking, heavy caffeine intake, and poor nutrition. So how do they determine if you have osteoporosis or what your bone density look like? They actually use a bone mineral density, or a BMD machine, and it uses X-ray and ultrasound technology to actually measure your bone's density. So what you're looking at is your T-score. So the T-score is a score that is reported from the BMD, or the bone mineral density test. It gives an estimate of risk, but not specifically a diagnosis. It's one of those catch or hit or miss type things. So typically, if you show low bone density, you are going to be diagnosed with osteoporosis, or osteopenia, which is the precursor to osteoporosis. So what can you do to prevent this? So lifestyle changes, first and foremost, weight-bearing exercise, and consuming foods high in calcium, stopping smoking if you smoke, reduce the amount of caffeine that you're taking. You can start taking supplementations, taking a vitamin D, but you want to make sure it's a vitamin D3, which is cholecalciferol. That's the most absorbable form of vitamin D. That's actually what we get from the sun. That's what your body utilizes. Calcium, Tums are okay. It's not the greatest amount of calcium that you're getting, but you're wanting to look for a good solid calcium supplement. And then for females, just kind of weighing your options for any type of estrogen replacement if your levels are significantly low. Another option is treating with biphosphonates, which are a drug class that is used specifically for osteoporosis, and they work by preventing bone breakdown by inhibiting the osteoclast from removing calcium from your bone tissue. So instead of allowing the osteoclast to remove that out for the regeneration of the new bones, it prevents that. So it keeps that level of calcium and that level of bone that you already have. So things like Fosamax, Boniva, you've seen those commercials on TV. They work really well. Actonel is another one. The only thing is they're very particular in how you take it. So for example, with the Fosamax, it needs to be taken first thing in the morning, has to be taken with a full 8 ounces of water, and then the individual must be sitting upright for at least 30 minutes after they take the medication. Selective estrogen receptor modulators, or SERMs, so raloxifene, or the brand name is Avista. This is something that is used because it works as an estrogen receptor, because it mimics the beneficial effects of estrogen on bone density. So it should basically trick your body into thinking that it has the additional estrogen that it needs to develop and regrow new bone. Other osteoporosis medications, so calcitonin, or known as the brand name is Miacalcin. This is actually an intranasal, so it comes in 2 forms. It comes as an intranasal, so it's a nose spray, and then an injection. So one thing that I like to tell my students with the Miacalcin is even though it's a nose spray, it's actually kept in the refrigerator. So if you ever go looking for it and you can't find it on the shelf, it's because it's a refrigerated item. Prolia, Forteo, they all work with inhibiting osteoclast formation and then stimulating new bone formation. So adrenal hormones. So your adrenal hormones, your adrenal medulla is the inner portion. It actually produces epinephrine, or adrenaline. The adrenal cortex is the outer portion. It has the corticosteroids. So glucocorticoid is an activity such as cholesterol, fat, protein metabolism, Your mineralocorticoid activity is such as electrolyte and water balance. So cortisol is actually your main adrenal steroid hormone, and we actually call that the stress hormone. So if you've ever seen those commercials, those weight loss commercials, and say, we target the belly fat for your cortisol levels. So what happens when we're under stress is our adrenal glands start to produce excess cortisol, and that tends to store in the body fat, especially around the abdomen area. So Addison's disease here is a life-threatening deficiency of your glucocorticoids and mineralocorticoids. So it's a deficiency in both. It can cause debilitating weakness, hyperkalemia, a bronze color of the skin in certain areas, low sodium levels, low blood pressure, and so treatment of that is actually a daily administration of a corticosteroid. Cushing's syndrome is an overproduction of steroids, so you have one that's a depletion and then the other is an overproduction, and so symptoms include a protruding abdomen, round puffy face, fat deposits over the shoulder blades. Treatment is usually surgery to remove the tumors, chemotherapy drugs to treat tumor and suppression to suppress the overproduction of corticosteroids. Diabetes, one of the most common diseases that affects a good portion of our American population and the world, in fact. So diabetes is characterized by elevated blood glucose, which is due to an insufficient secretion or use of the hormone insulin, which is actually produced in our pancreas. So insulin is produced to maintain blood glucose levels. Normal levels should be about 100 milligrams per deciliter. Levels consistently above 140 to 160 is associated with long-term effects of diabetes. Long-term effects of diabetes, especially untreated or uncontrolled diabetes, is the damage to our eyes, damage to eyesight, damage to kidney function, and then overall peripheral circulation. So types of diabetes, we have type 1 and 2. So type 1 occurs mostly in children and young adults, so juvenile diabetes, and then adults who are no longer able to produce insulin on their own and are considered insulin dependent. So when you are type 1 diabetic, you are going to be on injectable insulin. If you have type 2 diabetes, this is kind of the precursor to that. The main issue is insulin resistance. However, most patients are still producing some insulin on their own. Usually patients are overweight. It's a lifestyle change that needs to happen. The interesting thing about most patients that are coming into that pre-diabetic to type 2 is that a lot of times with diet change and lifestyle change, they're actually to reverse out of that. Gestational diabetes occurs in the second and third trimesters of pregnancy. It's treated with diet, exercise, and insulin. Even if the female has never been diabetic before, the pregnancy can induce diabetes during that time. Usually once she has the baby, everything resets itself and she's no longer diabetic. Now later on down the road, that individual would be at higher risk for developing diabetes later on. Secondary diabetes is due to specific drugs. So drugs such as oral contraceptives, beta blockers, diuretics, calcium channel blockers, phenytoin in particular, and then the glucocorticosteroids. So these drugs can actually induce a diabetic situation. Symptoms of diabetes, frequent infections, the presence of glucose in the urine, hunger, increased urination, excessive urination at night known as nocturia. So instead of going to the bathroom before you go to bed and sleeping all night and getting up the next morning, these individuals are getting up and having to go to the bathroom quite a few times throughout the night. Numbness and tingling, slow wound healing, thirst, visual changes, vomiting, and weight loss. So complications of diabetes: retinopathy, which is damage to the blood vessels of the eyes, which will eventually lead to blindness; neuropathy, which causes nerve dysfunction; vascular problems, which can affect all of your arteries, your blood vessels, and your veins; Dermatologic, you can get an increase in boils, acne, and fungal infections. And then nephropathy is actually when it affects the kidneys and you end up with end-stage renal disease. So treating diabetes, obviously attention to diet, exercise, maintaining blood pressure control, staying compliant with medication regimen, controlling of hyperlipidemia, which is increased cholesterol levels, inspecting your feet daily for foot ulcers, increasing physical activity, learning to recognize the signs of hypoglycemia, monitoring progress at home through blood glucose testing. Patient education is huge. Prompt treatment of all and any infections that happen, and then setting individual goals. So insulin is injected. Okay, there's many different forms of insulin. You have rapid acting, slow acting, long acting, intermediate acting, short acting, and they all play a vital role in how they deliver the insulin to our system, but they all are injectable versions. So again, slide 59 goes through the different types, your rapid acting and short acting, your intermediate and your long acting. It's important to know the difference between the insulins that you're dispensing and which ones are short and rapid and long, because you're going to see a difference in how they're prescribed. So for example, a long acting insulin like Lantus is going to be prescribed every 12 hours. So they may take it at bedtime only. If they have to take it twice a day, they may take it in the morning and then again at bedtime. So it just depends, but they're long acting, so they do not need to be given as much or as frequently. Rapid acting would be those kind of emergent situations. Sometimes they're used right after they've eaten, depending on what's going on, because the result of the insulin is very rapid. It acts very quickly. Incretin therapies, these are used to help mimic the action of the GLP-1, which is actually released when glucose is introduced into the bloodstream. These are kind of secondary medications to help aid in the insulin and how it's working. Metformin is a generic name for glucophage. It inhibits excess hepatic glucose production. It increases the insulin sensitivity in the muscles and other body tissues. So a lot of times the individuals that are pre-diabetic or type 2 diabetic, they're going to be on metformin. And with medication and diet change and exercise, usually they can either back off the amount of metformin they're taking or stop it altogether. Growth hormone. So your growth hormone plays a very fundamental role in metabolism. Deficiencies can occur in growth hormone. So you can have an intracranial infection, a skull fracture, radiation, cancer. So there's many different reasons why an individual would have a deficiency in growth hormone. Treatment. So there's actually synthetic growth hormone that we give. These are more effective when they are started at a young age. Catch-up growth for an individual that is starting a synthetic growth hormone is experienced in basically 80 to 90% of patients. Maximum growth within the first to 12 months of therapy, and minimal response after epiphyseal fusion. So one thing that's important to understand is if you have an individual that's just short, okay, my daughter is 18 years old and she's barely 5 foot. I am 5'8", my husband's 5'8", she's just small. But my mother-in-law is very small, my mom is very small, so she comes from a genetic background that she just got those genes of being very small. She would not be a candidate for growth hormone. If you had an individual who was failure to thrive and it was determined that their body was not producing growth hormone early on in the first few months of life, even up to a year, that would be a candidate for giving the growth hormone because their body is just not producing it. In the case of my daughter, her body was producing it, she just wasn't meant to be that tall. Okay. Alternative therapies. We're almost done to the end here, guys. So There are alternative or complementary or dietary therapies for female hormones. So black cohosh is very commonly used, as well as evening primrose oil, wild yam. These are not necessarily increasing hormone levels, but they're more to help with the side effects of decreasing hormone levels in women. So things like hot flashes, in the bloating and the nausea, and the insomnia that they're suffering from. Chromium and cinnamon are used for as complementary or alternative therapies for diabetes. It has been found or linked that there's a deficiency of chromium in patients with diabetes, but there's little evidence that shows that correcting that particular deficiency actually improves the blood glucose levels, but yet still people take it. Chromium actually should not be taken by patients with kidney or liver disease. Cinnamon has shown benefits in one study, but little benefits shown in later studies. So it's kind of one of those things of what people believe in, and what they're willing to take. So obviously taking a calcium and vitamin D supplementation over the counter is very beneficial for osteoporosis. It's important to take both calcium and vitamin D when you're treating osteoporosis. The calcium is needed for the osteoblast to build new bone, and the vitamin D is needed for calcium absorption from the GI tract. So the vitamin D is essential to have on board, otherwise the calcium is not going to be absorbed. And that finishes chapter 14.